Okay, there we go. Hi, I'm State Representative Jonathan Brostoff, and I wanted to give you an update on the spread of COVID-19, also known as coronavirus, and what we as a state and as a community can do to combat its spread. COVID-19 is a new respiratory disease that has spread rapidly across the world since it was first discovered in China at the end of last year. Because this disease is brand new, our populations don't yet have the resistance developed to it, and we also don't have the vaccines needed to combat it like we do with the seasonal flu. As a result, COVID-19 has spread across the world very quickly, which has been compounded by the fact that most people don't show any symptoms of the disease for up to 2 weeks, even though they are contagious throughout that period. While the vast majority of cases of COVID-19 have been quite mild, particularly among younger populations, the disease has proven very dangerous to older populations and to individuals with chronic health conditions. In order to protect those populations, we all need to do our part. As of right now, the risk to most of us in Wisconsin is fairly low, but we need to stay vigilant. By taking proper precautions, we can further decrease the risk to ourselves and to those most vulnerable to the virus, while giving our healthcare system time to treat those worst affected and hopefully soon develop the vaccines we need in order to combat this. Right now, there are a few steps that everyone can take to slow the spread of this disease. First, wash your hands regularly with soap and water for at least 20 seconds. Second, cover your coughs and sneezes. I know this sounds like common sense, but COVID-19 spreads through respiratory droplets, such as those expelled when you cough or sneeze, so we need to be extra vigilant about that. Third, avoid touching your face, especially your eyes, nose, and mouth. These are the easiest pathways for the virus to enter your system. Fourth, regularly disinfect high-touch surfaces such as doorknobs. Fifth, if you feel ill, stay at home from work. Unfortunately, without paid sick leave, that can be easier said than done, but it's incredibly important, and another reason why we need to get paid sick leave in this country. And finally, avoid close contact with others and practice social distancing. This doesn't necessarily mean that you have to lock yourself away from the world entirely or anything of that nature, but it does mean that you should begin to take clear measures. Avoid hugging and shaking hands with friends and acquaintances, and limit your exposure to large group scenarios. While this may not be the most fun, it will help protect vulnerable populations and it will slow the spread of COVID-19. This viral pandemic, like the opioid crisis, rapidly rising healthcare premiums, and other urgent national healthcare issues, further highlight the critical need for common sense policies to ensure universal access to healthcare, high quality childcare, and paid sick leave. I can't emphasize that enough. If we had put these things in place early, if we had more access to paid sick leave, we'd be way ahead of where we're at right now. And moving forward, this is a horrible reminder of how much we need to push these policies forward and get it done, because when something like this hits, it really highlights the need. We also need a responsible government that values expertise, that is committed to transparency, and that prioritizes the well-being of our people, not special privileged interests. As our nation, our state, and local community rally to address this pandemic, I will continue to seek change that prioritizes our most valuable resource, the health of our family, friends, and neighbors. We are all in this together. And again, this is another reminder of why you absolutely positively need experts in government and people who know what they're doing, not just sycophants and political appointees. There are times like these that we need to make sure things are running smoothly. Now, I want to take a moment just to answer a couple of the frequently asked questions and address some common misconceptions about COVID-19. Question 1. Isn't coronavirus just like the flu? Why do we need to take so many precautions for something so mild? While it's true that COVID-19 has so far resulted in a relatively mild flu-like illness for most people who have contracted it, it is far more dangerous than the flu for individuals over 60 and those with pre-existing chronic health conditions. Additionally, COVID-19 is significantly more contagious than the flu, particularly due to its up to 2-week incubation period, where someone can be contagious without presenting symptoms. And unlike the flu, we don't yet have a vaccine for it. Question 2. Can I just use hand sanitizer instead of washing my hands? Hand sanitizer will neutralize the virus, but leave it on your skin. Whereas washing your hands with soap and water for at least 20 seconds will actually wash the virus away completely. Question 3. It seems like everyone is overreacting with these calls for social distancing and canceling so many events. If only some people are at particular risk for coronavirus, why should we all be expected to change our lifestyles? I mean, ultimately, we live in a society, and while you may not personally be at high risk for a dangerous case of COVID-19, it is very likely that someone you might come into contact with is either themselves at high risk or that they might interact with someone else who is at high risk. By everyone, all of us doing our part to help limit the spread of this disease, we can protect both high-risk individuals as well as our healthcare system. Also, by the way, reducing the overburdening of our healthcare system is of benefit to everyone. Question 4. I've heard some people use the phrase flattening the curve. What exactly does that mean? Well, coronavirus has already passed the containment stage, meaning that it's already widespread enough that we can't really isolate it effectively. Therefore, at this point, the goal is to spread out the effects of the outbreak over as long a period as possible so that our healthcare system is able to use resources effectively and help as many people as possible who need it. If we don't take any precautionary measures, such as those suggested by the World Health Organization, our healthcare system would not be able to keep up with the rapid spread of new cases. Flattening the curve refers to this equilibrium, to spreading new cases out over a long enough time period that the healthcare system is able to properly respond to all of them without becoming overwhelmed. Question 5. If this is as serious as some people say, should I be stockpiling up on supplies? In times like this, it is good to make sure that you have enough food, medications, supplies, etc., to last you in case you are exposed to COVID-19 and you need to voluntarily self-isolate. But you don't need to stockpile months' worth of these things. Remember, there are other people who are trying to prepare, and we live in a society, so use your best judgment. But just in case you need to self-isolate if you do get exposed, it is worth taking that into consideration and making sure that you have a proper amount of these things. So thank you very much for tuning in. Please help spread the word, get good information out there, let people know, share this video. We will get through this together, and we will be working towards the good of our community and looking out for each other throughout this and future such sorts of situations that will arise. But the more we do that, the more we're looking out for each other, the more good work we do for each other, the better off we'll all be. We are all in this together, and we need everyone to really step it up and realize that this, as declared by Governor Evers, this is a state of emergency, but with clear plans and proper guidance and looking out for each other and being there for each other, we will get through this together, and we will minimize harm and maximize our own effectiveness in treatments and prevention. So again, thank you very much. Please help spread good information about this. And if you have any questions, feel free to contact my office now or moving forward. Again, this is State Representative Jonathan Brostoff. Thank you very much. Take proper precautions, stay safe, and have a great day.